Welcome back to Living Local. For Wellness Wednesday, we're focusing on women's health. And today's topic is an issue many women face but may not feel comfortable reaching out for help to find a solution. We're talking about urinary incontinence during exercise, and it can cause a lot of females to avoid working out altogether. But experts say with the right steps, this problem can be treated. Joining me in studio is Dr. Beth Shelly, doctor of physical therapy and board certified in biofeedback for pelvic muscle dysfunction. Thank you so much for being here, Dr. Shelly.
Thank you for having me.
So first of all, what is the root of this problem? Because you're telling me that it's not normal. There is a root to this problem.
Yes, and of course it's not as simple as one thing.
Sure.
There are many factors that can contribute to urinary leakage. The most common is having babies. That after a baby, it is weakened and the muscle needs to be strengthened. And of course we've heard of Kegel exercises, but do we really know how to do Kegel exercises? That's where the problem comes in. About 40% of people don't know how to do them correctly. So I'm hoping today we can share some thoughts with your viewers on how to do them correctly.
Definitely, and we will be getting into that shortly, but first, how common is this problem? How many women actually do struggle with this?
You know, it's nationwide about 9 million.
Wow.
And you can see the commercials on TV for medications that help the bladder and, unfortunately, for diapers, which I think are not necessary.
Right, and so that's kind of just like fixing the problem temporarily or just dealing with it, but we're getting to the root of the problem today. And you mentioned Kegel exercises, so how do people know if they're doing those correctly or if they're even just making the problem worse?
Yes, that is a challenge, and in any kind of activity that we learn, the important item is feedback. You have to have more information. If you're learning how to ride a bike, you know that you've learned wrong because you fall off.
Right.
So we need information. And it is helpful to know where the muscle is first. So let's take a look.
All right,
at
brought
the
a
pelvis.
Brought a prop.
And here we are in the sitting position. The muscle is here. So this is the pelvic floor muscle, and it is the floor of the pelvis.
Okay.
This muscle goes around the rectum and the vagina. And those are the areas that you're going to focus when you do this contraction.
Got it.
So the very best instruction that I have is hold back gas.
Okay.
And I would say in church, because nobody should know that you're doing this.
Right, right.
It isn't squeezing your eyes, it's not moving your legs, it's not pinching your butt. Nobody should know you're doing this contraction.
Got it. And then what are some ways that people can be doing it wrong then?
Well, the worst way is that they are pushing out.
Oh, okay.
Pulling up is where the correct contraction is. Pushing out actually makes the problem worse, and it can contribute to further difficulties like prolapse.
And and Dr. Shelly, you mentioned biofeedback is very important as well. So you brought a device today to explain a little bit about how that biofeedback works.
Yes, there are several ways to know what you're doing. The simple way, can we start with simple?
Yes, I'm down for simple.
Simple is a mirror. Take a mirror and look at yourself and watch that area to see what you're doing. If you're doing it correctly, the area should move up into your body.
Got it.
If it isn't really moving very much, put your finger in and feel the movement up. And if neither of those things work, then you need to get more information. The first thing to do would be to check with your physician, and maybe they can help you to know how it is done. Midwives and obstetricians routinely teach this muscle. And if it is very weak, then we get the machines out.
Okay.
And that's what this is here.
Right.
There are several different forms of feedback, and this is a very simple device, and you can see when my muscle is very relaxed, the bar is down low, and when I squeeze, it goes up. So down, relax, squeeze, contract. Down, relax. So this helps a person to understand which muscle is squeezing and how well it's squeezing. But there's even more than that. A lot of times when people come to me, they say, I've been doing Kegel exercises for 4 years and they don't help. Well, they're not done well, they're not going to help. And just like every skeletal muscle in the body, you need to work the muscle to its full potential. Squeeze and relax does not help. That's just a waste of time.
Okay.
What really is important is squeeze and hold.
Gotcha.
It is one of those muscles that has to last for a long time.
How long do you hold it for?
Well, the gold standard is 10 seconds.
Okay.
But that's quite difficult. And in the beginning, oftentimes people have to start with 3 seconds or 5 seconds. It could be quite short.
And then you work your way up to that 10 seconds, hopefully.
Correct.
Okay,
Yep.
that's good to know.
And then how many repetitions should you do?
That's a good question. 10?
Well, if you were a patient of Dr. Kegel's, you would do 300 a day.
Oh, wow.
Now, we know now from very good studies that you don't need to do 300.
Okay, good.
But you would do nothing else but Kegel exercise. So you need to do at least 10 in a row.
Okay.
And then if you can, work up to 30 in a row. And if you're having a difficulty, I'm hoping for 60 to 80 a day.
All right.
And these are often started in the lying down position, not in the sitting position, and not while you're driving, and not while you're watching TV.
So you really have to take the special time out of the day to really focus on strengthening this part of your body.
That's right.
Now, in addition to the biofeedback and the Kegel exercises, abdominal exercises, can they help? Can they hurt? What's the deal there?
The answer is yes. They can help and they can hurt. The belly muscle is a buddy of the pelvic muscle. And if the belly muscle is pooching out, the pelvic muscle is sagging down. So when you do exercises that pop out the belly, then you are having more sagging of the pelvic floor. And that can be a big problem for people with prolapse or leakage. So when you do exercises, pull in the belly, and that will protect the pelvic floor.
Very good information. And November is actually Bladder Month. So what kind of awareness do you want to bring to this topic?
I think the important thing is that you don't need to leak. It is not necessary. Please don't consider, I've had a baby and so I'm going to leak. I'm older, so I'm going to leak. A lot of people think that is true, but it's not true. Treatment can be 80% effective with no medication and no surgery. So I really want to empower women to do something, to seek help, to say something to their physician or midwife, or to call and have a therapy evaluation in order to know if you're doing it right.
And what kind of testing and treatment do you offer?
The treatment would be in specifically training the pelvic floor muscle and the bladder, because sometimes the bladder is misbehaving. I have several machines in my office that show the muscle contraction and follow along over several weeks to see that it's getting better and that the symptoms are improved. And if that's not effective, then we get back to the more invasive things that physicians can offer that may be useful.
All right, Dr. Shelly, thank you so much. Such important information today. We appreciate it.
Thank you.
If you would like some more information, you can visit BethShelly.com. We'll also have those details that you're seeing on your screen. There's the address there as well as the phone number 563-940-2481. All of that will be on ourquadcities.com. Stick around, more Living Local is coming up.